My name is Ken Hovden. I've been practicing dentistry for over 35 years, serving the Greater Bay Area. So I'm a third-generation San Franciscan. Both my mom and father are dentists, and when I was a senior in college, it kind of all clicked and I decided to head to dental school, and I've never regretted a day since then. It's been a great career, and I enjoy it every day. I do a lot of continuing education every single year, and I do some teaching also at some of the top continuing education facilities, I believe, in the US and the world. It allows me to be doing the best level of care that I can for my patients. What I kind of say, I'm passionately pursuing excellence, and you never quite get to excellence. You're just always pursuing it. I get great pride in helping others raise their game, but it forces me to raise my game too. I have a long conversation with the patient. My initial exam is normally an hour and a half to 2 hours, so I can really get an idea of what the patient's expectations are and where they're trying to go. I want to make sure that when we're all said and done, I have satisfied what the patient wants to have done, and that we both get a big hug at the end because we've gotten to the end of the journey together. It's very important to me to do the least amount of dentistry that I can do and accomplish the result that the patient is hoping for, because no dentistry oftentimes is the best dentistry. So we can do a lot of things in our office, from simple tooth-colored fillings to individual crowns, up to smile designs of people who want to do veneers, and you can do prepless veneers sometimes. We do full reconstructions for patients that are badly broken down on their natural teeth. If implants are involved, we plan it with implants. The good news is I know when we need to bring in the interdisciplinary team to get the result that our patients really need. Oftentimes patients come in with a variety of problems, and a lot of them are very severe and they're almost dental cripples. And the challenge for me is to try to work out a plan that can bring them back to normal function so they can start to eat and chew and enjoy foods they haven't had in a long time, and to give them the confidence to smile in public. Because a lot of patients come in, you ask them to smile, their lips don't move, their hand comes up over their face. They're just very embarrassed. So to give them the confidence to walk out and smile, it's great.
I am Mary, and I've been a patient of Dr. Hovden for 2 years. I had a chip in my tooth. I went to this doctor that was highly recommended, dentist, and it was a nightmare. I went in and she told me that I would need an implant, a root canal. I didn't even know what that meant at the time. So I let her do it, and at the end of it, awful. So I didn't go back. I had to go to work with no tooth for about 6 months. I was like, I'm over it now, I don't care. This is it. I'm over it. One of the doctors that I work with kindly referred Dr. Hovden, and I cannot say enough about this man. He's fantastic, brilliant. I didn't feel nothing, and I swear I'm just so emotional now. He's just a godsend. He's brilliant. And 2 years later, I can smile, which for a long time I couldn't do. And sorry. Anyway, he's wonderful and he knows what he's doing, took his time, and just professional, lovely bedside manner. And I just can't say enough about this person. I'm just so delighted I met him. And here I am 2 years later and I can smile. So I'm delighted.